Hello, and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. Have you ever had to endure the impatient stare of a patient who has just dropped off their prescription at your front window and is wondering why it takes so long for the pharmacist to count out a few pills and put it into a bottle? They want to get their prescription and head on home because they're not feeling well. Or in the inpatient setting, that call from the nurse who just received an order from the doctor for that stat for a constipated patient and is wondering why they don't have the drug in hand to give to the patient, even though the order was just written 10 seconds ago. These are the things that we've had to deal with for a long time, the dispensing aspects of pharmacy practice. And the fact that whether it's the patient or the clinician administering the medication, the expectation is that orders are filled immediately. Now, we've talked in the past in a Journal Club article review about NUPOR, the Nearly Universal Pharmacist Order Review, the article written by Dr. Flynn many years ago. And we talked about the fact that the pharmacist has to verify every prescription and every inpatient medication order before the first dose is received by the patient. So it's our duty to do that. And this is not just a dispensing thing. You know, we're using our clinical knowledge. We're looking at the 5 rights, make sure that the medication order is for the right patient, it's the right drug, and it's prescribed in the right frequency by the right route, and it's to be given at the right time. We also want to check and make sure that the patient is not allergic to the drug. We want to know all about their medications, other medications that they're taking, to make sure that there are no drug-drug interactions. And we also want to know about the patient's condition, disease states, comorbidities, to make sure that what's being prescribed is the right medication to treat that specific issue. Now, when we look at it from an administrative point of view, order review, order verification, and the time it takes to fill orders is something that we call turnaround time. So from the time that the prescription is written and taken to the pharmacy and then filled and the patient receives their counseling and their medication, that's the turnaround time for a prescription, from prescription writing to a prescription filled and in hand by the patient. And in inpatient setting, it's the ordering of the medication and the verification by the pharmacist and the dispensing, and then having the nurse have that drug in hand to administer to the patient. So this is something that I've dealt with for many, many years, even before getting into pharmacy informatics as a pharmacy manager. We always are concerned about pharmacy turnaround time, the medication order turnaround time. How long does it take us to fill that inpatient order, or how long does it take us to fill that prescription from the time we receive it to the time that it's actually dispensed? As you know, this is all about pharmacy informatics, and pharmacy informatics has really revolutionized how we dispense medications and had a direct effect on turnaround time. As a pharmacy informaticist, you need to be very aware of this data analytic statistic, this data about how long it takes us to fill orders and prescriptions, because you are responsible for all the technologies that we've implemented. You are involved with electronic health records, pharmacy applications, and in the outpatient or retail setting, e-prescribing now, not written medication prescriptions, but e-prescriptions. And in the inpatient setting, CPOE, computerized provider order entry. And so we have electronic prescribing. And then we have those prescriptions ending up at a pharmacy on their queue within their computer, or in the inpatient pharmacy on their EHR queue. And these orders are verified. Once they're verified, then pharmacy automation can come into play. And in the retail setting, we can have prescription filling robots and counting machines that help us fill those prescriptions in a timely manner. And we also have patient-facing kiosks where we can put those medications once filled in a kiosk for retrieval by the patient. That can speed up the process. And in the inpatient side, automated dispensing cabinets really revolutionized how we dispense medications. So we can place the top 300 drugs into an automated dispensing cabinet and place it up on a nursing station floor. And then when the order comes in through CPOE and is verified by the pharmacist, that can release the drug in that automated dispensing cabinet for that patient, for the nurse to retrieve that medication and then go ahead and administer that drug to that patient. So when we talk about order review and turnaround time, there's been quite a significant impact on these parameters because of pharmacy information technology and automation. And so I saw a recent blog post where somebody was asking about standards. So apparently there are Joint Commission standards on how long it should take to fill a prescription or inpatient order specifically. And when we talk about this, we have to get into the details of the type of order. So is it a stat order or a now order or a routine order? And depending on whether it's a stat, now, routine, then the standard for how long it takes to fill it might not be defined specifically by the Joint Commission, but I believe that they expect you to have some kind of a standard to say in a policy and procedure at your hospital, and this is something that would be P&T approved, Pharmacy and Therapeutics Committee approved, where you say, well, we're going to ensure that stat orders are filled within 15 minutes, and a now order is filled within 30 minutes, and a routine order is filled within 1 hour. And then you need to be held to those standards. Now, data analytics comes into play here because we have real-time data that we can get from our EHR, from our automated dispensing cabinets and interfaces that we have that can collect that data within the EHR. And we also have a link to our EMAR, our electronic medication administration record. So on the inpatient side, we can know exactly when the order was written, when it was verified by the pharmacist, when it was released in automated dispensing cabinet through the interface, when it was taken out of the cabinet to give to the patient, and then using barcode medication administration at the bedside, scanning that, and then having that recorded within the EMAR as being given to the patient. And all of those data are available and then can be analyzed. We've talked about dashboards, so you can have dashboards for the pharmacy administrator to keep track real time on what's happening with pharmacy order turnaround time. And we can also have other more detailed reports that kind of aggregate the data and look at turnaround time by order type, stat, now, or routine over a period of time, a day, a week, a month, and look at averages and look at trends and see if we're improving, and if we're not improving, where we have the opportunities for improvement. So here you go, pharmacy informaticists. This is one of your responsibilities, one of the items that you'll be directly involved with tracking, implementing the proper technologies to be able to improve medication order turnaround time, to make sure that we're providing optimal therapies to our patient in a timely manner. And so you will be involved with all of this. Another aspect of pharmacy informatics that maybe you don't think about, but this is definitely something that I've had to deal with in the past as a pharmacy informaticist, and I'm sure you will too in your position as a pharmacy informaticist or as a pharmacy administrator. If this discussion was interesting and helpful for you, then please like the video and subscribe to my channel, and I'll thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others, and I'll continue to work on more episodes and hope to see you next time. Take care.